Knee osteoarthritis breaks down cartilage, causing pain and stiffness that worsen over time. Many patients want alternatives to joint replacement, and stem cell therapy is gaining attention as a supportive option. Most research uses mesenchymal stem cells from bone marrow or fat tissue. These cells do not rebuild cartilage directly, but instead release signals that calm inflammation and support the body's repair processes. A 2025 meta-analysis of 502 patients found stem cell injections significantly improved pain and function scores compared to controls. Adipose-derived cells showed clearer benefits than bone marrow-derived cells. Long-term data suggests that bone-based injection techniques may delay the need for total knee replacement, with only 20% of treated knees needing surgery after 15 years. Reported side effects are usually mild, such as temporary swelling or stiffness. Serious complications are rare, but long-term safety data is still limited compared to standard surgery. Stem cell therapy works best alongside physical therapy and weight management. It is not a cure, but can offer meaningful pain relief and improved function for many patients.